Hi, this is Dr. Minkoff, LifeWorks Wellness Center. I want to talk today about prostate cancer. This is Men's Health Month, and prostate cancer is definitely a problem in men. It is estimated that 100% of men, if they reach age 80, if you went in and biopsied their prostate, that you would find that they had prostate cancer. It might be local, it might be small, but that it's there. The prostate anatomically is in kind of a unique position. It is at the bottom of the body. So it sits, if you're a man, right behind the scrotum in about an inch. And the purpose of the prostate is that when you ejaculate, there needs to be fluid to carry and nurture the sperm. And the prostate manufactures, it's a gland that manufactures that fluid. Now it sits, if the bladder is sitting here, the tube, which is called the urethra, goes out the bottom of the bladder through the prostate gland. So the prostate gland is sitting right here. It's about the size of a walnut. And the urethra goes through the prostate and then out through the penis. If there is an ejaculate, so the sperm would come from the testicles. So the testicles make the sperm, it comes up and enters the urethra right before the prostate. The prostate fluid then is added to it, and then it comes out. Now the prostate then is at a very low level in the body. Toxins and things tend to run downhill just by gravity, because most of the time we're upright rather than laying down. And so the prostate is a place where it can collect a lot of stuff, bad stuff, and this bad stuff can cause infection or inflammation in the gland. Now usually when people are young, it isn't a problem, but as they get older, this prostate is in kind of a capsule. It's kind of a stiff capsule. And the gland is in the middle, and the urethra goes right through it. If the gland gets inflamed or infected or it collects toxins, the tissues tend to start to swell. And it can only swell so much to where it hits the capsule, and then it starts squeezing in on the urethra itself. Now, if you're trying to pee through a squeezed down hole, it makes it difficult. And so people who have prostate enlargement, they may have trouble emptying their bladder, or their bladder may partially empty, but there isn't enough pressure to get it all the way out, and then their bladder stays full and they've got to pee every hour. Now, enter into this situation. What can you do with it? Like, is there anything that you can do with it? Now, this prostate gland then, because it can be infiltrated with various types of toxins and infections, sometimes those cells become cancerous. And if they become cancerous, it can grow within the gland, or it can grow on the outside of the gland. And usually men annually should get an examination where the doctor's finger is put in the rectum, and just inside the rectum is the prostate. So if the prostate is big, you can feel it on the finger, it bulges out. Or you can feel little ridges, little hard ridges, if there's cancer in there, on one side of the prostate or another. So this is something that men really need to be checked. Now we do blood tests for prostate cancer, which is called a PSA, prostate-specific antigen. Usually with prostate cancer, the PSA starts to become elevated. Now in the regular lab tests, the levels of PSA are usually 0 to 4 or 0 to 4.5. Sometimes people get inflammation or infection in the prostate and it'll go to 4, 4.5, maybe even 5, 6, or 7, sometimes even 12, 13. If someone comes in and they have a high PSA, I have to be able to discriminate between, is this prostate cancer or is this what's called BPH, benign, which means not a problem, prostatic, prostate, hypertrophy. Hypertrophy means it grew. And when the gland grows, this PSA level can go up. It can also go up if a person's been on a bicycle for a couple hours because the seat may have rubbed it, or if they had sex the night before, it may raise the PSA. So if I get a high PSA, I always recheck it, and I tell them no sex for 3 days and no bicycle riding for 3 days to make sure that I've got an accurate one. If the level is elevated, I get an ultrasound of the prostate. I want to see what size it looks like. Sometimes an MRI of the prostate. I am looking for tumors. Now, if I don't see a tumor in either one of those tests, and the PSA is, let's say, 4.5 or 5 or 6 or 8 or 10, I am very unlikely to send that patient to a urologist because they will definitely do biopsies. Now, the biopsy procedure means that through the rectum, they will take a needle and they will put it through the colon wall into the prostate 12 different times, get tissue, pull it out, and look for cancer. I'm worried that if you do have smoldering cancer, there is a possibility that those cancer cells, which were once inside, now you've poked the capsule 12 times, can get outside. We don't want that. We don't want spread. If you don't see a mass, and we're able to control the PSA using nutrition and detoxification and these other things, then there isn't any reason to biopsy it. We may look for other tests to see if there's evidence of cancer in the body from the prostate, but by and large, there are many men who have benign prostatic hypertrophy. They don't have prostate cancer. They shouldn't, in my opinion, go get biopsied for a PSA that's 4.5 when normal is 4.4 or 4.0, because it just isn't there. Now, if we see that there is a mass there, oh boy, this guy's got cancer, we take a completely different approach. But what we need to identify is this cancer or is this not cancer? And that's really important. And I think that the treatment for prostate cancer is surgery, putting radioactive seeds in there, nothing, or hormone suppression if someone's really got prostate cancer. Now, none of those offer a very good solution. The number of men that have prostate surgery with the idea that we can take out the prostate and it'll be all fine, many men who get that procedure, the prostate cancer cells have already gotten out of the prostate before the surgery, and you do the surgery, but the cancer's circulating around in the guy's blood and he can show up with it somewhere else. It's not always curative. In fact, a lot of times it's not curative. So I'm very leery of that, because somewhere in the 15 or 20% range, that guy's not going to get an erection again, and he's going to have trouble holding urine because he's going to leak all over the place. And that's an outcome that is common enough with that surgery that I am very leery of it. So I'm trying to do alternatives where can we handle the gland without somebody going in there and radiating it or operating on it or poking it or doing something. Now, sometimes radiation is done there too, but radiation, of course, causes cancer. It's in an area of the body where there are a lot of tissues and where damage is possible. So I don't like those options for most men. Okay? So prostate cancer is a real thing. It is one of the most common cancers in men. It needs to be screened for by men. So everybody 30 years old or older, as part of our routine screening, we get a PSA. And we are looking to see if it's elevated or not. If it's elevated, we go down this road of what is it? And if it's not elevated, then we don't worry about it. So that's prostate cancer. Now, there are decent treatments for prostate cancer. We treat it in a way that doesn't make the most usual method for prostate cancer is that it's hormone suppression is used. So what you do is you turn a guy into a female. You make his testosterone so low that he gets breasts and he doesn't feel good and he loses his vigor and he loses his drive. And we can often handle it in another way where we don't have to resort to that kind of thing. Okay? So it is important to know you should get an annual test, and if you went to your regular physician and you had a minor elevation of your PSA, I would recommend you come and get an evaluation by us rather than go running right to the urologist and getting biopsies, because usually we can handle this. Okay? Hope this helps.